Welcome back. There have been notably low vaccinations on weekends across the country. The health department says this is attributed to budget constraints, but it will undoubtedly add to the slow rollout overall. The Health Department Deputy Director General, Dr. Anban Pillay, joins me now to discuss this. Dr. Pillay, thank you so much for making time. Let's start with perhaps the vaccine rollout for teachers, which started today. How did things go?
Good afternoon, Clement, and good afternoon to the viewers. From all accounts that we've received thus far, it seems that things went well for a first day. I know there were a few areas where people had some IT issues at some sites, and I think our IT team were trying to resolve those. But generally speaking, I think it went well for today. We will have a catch-up call later this afternoon just to understand what issues arose and see how we can resolve those those challenges that may arise.
Yeah, I wanted to also get your thoughts before we get to the low vaccinations we see on weekends. We're hearing about this new variant in India, the Delta Plus. India says it's a variant of concern. We know that viruses mutate. We are going to discover new variants as we go. Are you aware of this Delta Plus variant, and how concerned are you about it?
Yeah, I think each of the variants that arise present additional challenges, and I think the variants that have been identified, such as the Delta Plus, are going to pose a challenge to the health system. What we don't know about the variant as yet is that how more contagious it is. Is it more transmissible? Does it cause greater pathology, etc.? Those kinds of details we don't have yet. There's an international committee of the WHO that monitors this and tries to get as much information for countries as possible. Many of our scientists are sitting on that committee, and so we will wait for feedback on what are the effects of these variants on each country in terms of transmissibility. I do want to say that as the pandemic progresses, and when there is uncontrolled spread of the virus, it will generate variants, and these variants will be sometimes less severe than the current one or more severe. And so we need to understand how best to manage this. And I think vaccinations is a particular solution to that problem.
So we've been noticing the low vaccination on weekends. What's the impact of this low vaccination rates on weekends on the broader vaccine rollout program?
Well, we had low vaccination rates on weekends largely for two reasons, and I think you mentioned the first one, that provincial departments of health have limited budgets, and this obviously is expensive for them in terms of overtime costs. But the second was, over the last 4 weeks or so, we've had limited supply of vaccines because the Johnson & Johnson vaccine, as you would recall, was still stuck in the processes with the FDA. Now that some of those processes have been unlocked and we're getting significantly more doses of vaccine than we had previously, we've raised the question with our colleagues in the provinces, as well as with our colleagues in Treasury, that certainly we're going to need additional funding, because you're absolutely right. We should try and vaccinate as many people in the shortest period of time, and weekends are certainly part of that. And I think many people have asked for this. So we're certainly looking into how best we can do that. This may include us raising this question with the universities, where some of the final year students in the various health science faculties, with its medical or pharmacy or nursing, could certainly assist on weekends to do some vaccinations, and I think that will help to get as many people vaccinated as possible.
And my understanding is the provincial departments say they don't have money to pay staff to vaccinate people over weekends because that's overtime. Are funds supposed to be coming from the national department, or should they be budgeting for this exercise as provincial health departments?
Well, provincial departments of health receive their budgets in the form of an equitable share. In addition, there is a grant that the National Treasury had made available. Their argument is obviously those funds are insufficient for this, but I think the other argument is obviously there weren't as many vaccines around to do vaccinations on weekends. But I think that scenario has now changed. There's many more vaccines being delivered in this week and then next week as well. And so we need to revisit that argument and see where we can mobilize funds from, because it really can't be that we don't vaccinate on weekends.
Yeah, but you do confirm that there are budgetary constraints.
Yes, certainly they are. Yeah. That's true.
And maybe if Digital Vibes wasn't allowed to loot so much money from the National Health Department, that money would have gone a long way in helping out. And I say this with the greatest of respect, Dr. Pillay.
Yeah, I mean, we would like to, mobilize funds from wherever it's possible in order to be able to obviously pay for the overtime of staff. Yeah.
Yeah, and I guess the problem with this is the accessibility of vaccines, because that is so important, especially on weekends, which is the time when most people are off work and available to take the jab. So what's the plan going forward to resolve this? You said you're going to start having conversations with the provincial departments to try and resolve this so that you speed up the vaccination rollout on weekends. What's the actual plan?
So the plan is we've laid out to provinces the flow of vaccines that are coming into the country, and clearly, in order, if they continue at the current pace, they will be falling behind, because we would have more vaccines arriving than those that are getting into patients' arms. And so the idea is we must make sure that that pace increases significantly. So we have put it to them that we're going to have to make some sacrifices and make sure that people are working on weekends, and we have to find the money for the overtime. We're also going to be raising it with our colleagues in Treasury. In addition to that, we are also approaching universities, requesting that maybe some of their students, the final year students, could certainly pitch in with some of this on weekends as well. So I think between all of those measures, hopefully we would be able to come to a solution where we can have vaccination on weekends. Many people have raised the issue that you raised, that on weekends I would prefer to be vaccinated, or even for the elderly, their family members, to bring them to a vaccination site. It would be much easier when they're not working.
And I would like to get your response as the Health Department, Dr. Pillay, on the latest developments coming from the SIU this afternoon. It's been granted an order to freeze 22 million rand in bank and investment accounts linked to Digital Vibes and those who received payments from the company. I mean, this is the company that looted money from the department. So your response as the Health Department?
Well, look, I mean, I only just read it in the media. I have no further information on it, so I'm not able to share anything else in addition to that. I'm not sure if any formal communication has come through, but I just read it in the media like you.
All right. Anban Pillay, Dr. Anban Pillay, thank you so much for your time on The Lead this afternoon.